Last year, Norfolk Southern, our company, spent about $500 million on employee and retiree health care. I used to be the CFO of the company, so I'm used to big numbers, but that still takes my breath away. $500 million in 1 year. So we obviously have a big stake in engaging consumers, especially our own employees and retirees, to seek value in health care. And we're making progress at that. We, that is, large employers, are becoming more sophisticated consumers of health care. We're becoming more adept at exercising our bargaining power and more determined to use it in the face of steadily increasing healthcare costs. And we're also starting to deploy technology from the realm of e-commerce that will make costs and outcomes more transparent and manageable in the future. The question is whether our growing consumer sophistication, the employer's growing consumer sophistication, will translate into consumerism on the part of our employees. And frankly, I doubt it will, as long as employers are funding the lion's share of the cost. People behave like consumers when they're spending their own money. And for that kind of consumerism, real consumerism, to take hold in healthcare, I think the employer-provided healthcare exclusion from income taxes may have to go. So that's a policy prescription, and I'll explain why. Secondly, with the push for consumerism in employer-sponsored healthcare, information security and privacy need to be signal concerns. These days, we all know that IT and the internet are the twin engines of commerce, and they soon will be, if they're not already, the critical tools for getting people to act like consumers when it comes to their healthcare. But even with a host of legal protections, and there is a host of legal protections, do we really want the mechanisms of e-commerce applied to healthcare in an employment context? That's my second question. Needless to say, I can only scratch the surface of these topics this morning. But let me start with the employer-provided health insurance exclusion, which is the foundation of the current system, and by the way, reportedly the largest single tax expenditure in the Internal Revenue Code at $164 billion. So that's a very large tax expenditure. Many of you probably know that exclusion has an accidental origin in wage and price controls during World War II. It's a very interesting history. I don't have time to cover it this morning, but suffice it to say, no one in the private sector or in Congress sat down and said, hey, you know, employers would be the ideal party to offer health insurance. It just happened. And as powerful constituencies developed around it, it became enshrined through the Internal Revenue Code legally, and it's the system we have today. And today, for those fortunate enough to have employer-provided health care benefits, it's just the way things work. But setting aside the tax benefit, it's far from clear that employers should sponsor health care. Indeed, many people have noted that the arrangement may actually impede consumerism. So, for example, the Joint Committee on Taxation stated back in 2008, and I quote, "The tax treatment of healthcare affects the healthcare market and can distort consumer choices. Reduced taxation of income spent on health insurance is an implicit subsidy to eligible consumers. This discount on the employer purchase of health insurance provides an incentive for the purchase of more generous health insurance benefits than would otherwise be purchased without the discount." And besides the factors cited by the Joint Committee, I would add as a contributor to market inefficiency in this area is the fact that employers are not just agents, but participants in this market. And employers have their own interests stemming from the fact that the majority of the total cost is borne by us. So in a situation where one party is paying and the other is consuming, there's always a risk of inefficiency, friction, and even conflicts of interest. Okay, now turning to the technology that we'll use to foster consumerism in healthcare, information, security, and privacy should be paramount concerns. And I ran across an interesting quote recently from a new book, The New Digital Age by Eric Schmidt, Google's executive chairman, and Jared Cohen. They offered what to me was an Orwellian-sounding definition of the sort of technology that I think could be easily misapplied in the healthcare arena. They called it complex feature extraction and trend analysis software suites. Do we really want that technology utilized by employers and service providers in connection with employees' healthcare information? That's something we should think about. The law obviously provides safeguards against inappropriate use of healthcare information, and most employers will make every effort to comply with the law and protect employees' privacy. But there will be areas where the law is unclear, and if using these kinds of tools, there's an opportunity to reduce spending, employers will seize upon. And service providers as well will have a strong economic incentive to promote products and services while nominally gathering and synthesizing healthcare data. So to summarize, I believe the exclusion from income taxes for employer-provided health insurance is an essential, repealing the exclusion is an essential prerequisite to real consumerism in healthcare. Employers may fear new taxes and regulatory burdens from that kind of a policy change, and it's certainly debatable whether government-sponsored exchanges will promote consumerism better than we can, even in this inefficient market. Moreover, employers are in competition for labor, so as a practical matter, whether we offer insurance benefits will depend on the actions of our competitors and market conditions generally, as much, if not more so, than on tax policy. Nevertheless, unless Congress addresses the market inefficiencies caused by the insurance exclusion, I'm not convinced we'll get the consumer behavior we're seeking, no matter how much technology we put in people's hands. And I also believe there are serious security and privacy concerns revolving around the use of that technology in the special context of employees' healthcare information. Thank you very much.